9 minutes. I want to talk to you about this robotic surgery. It says linked to 144 deaths since 2000. And basically they look at all the issues that has happened during the robotic surgery. The bottom line is that FDA is looking into this to find out what's going on. And I can tell you, without even getting into details of this study, that the issue is not the robot. The issue is not using the Da Vinci technology. The technology, we've been using it for the last 14, 15 years. I was one of the first ones in the country who started using robotic surgery, and I've done now well over 6,000 cases. You need to have a team. You need to have a program, and for a lot of patients, they need to know that going to a center of excellence, find out who is doing your surgery. There are surgeons that basically go from room to room, and it's like a factory, and they're not even present. They're not doing your operation, and everybody else is doing part of it. Well, guess what? You're going to have complications. You know, is your surgeon just a robotic surgeon? Is he a laparoscopic trained? What if the robot doesn't work or stops working? It's a piece of technology that happens to be extremely rare, but the team in the OR and your surgeon has to be able to troubleshoot and be able to do this. You can't just take a weekend course and come back and claim you're a robotic surgeon. I get calls from patients from all over the country, and I talk to them. They say, hey doc, you know, I have a robotic guy. Just yesterday I talked to somebody. I have a robotic surgeon right here in Massachusetts. You know, is it okay? It's a robot. And they think that the robot is doing the surgery, which is wrong. It's the experience of the surgeon that matters. And my answer was, how many cases does this surgeon do a year? And he said 30 cases. I was in shock, because if you do 30 surgeries a year, you're probably not qualified to have good outcome and good results. We're talking about prostate cancer. We're talking about nerve sparing. We're talking about your continence. So I always say that an experienced surgeon plus the technology of robotics means good outcome. That's your continence, that's your sexual function. Inexperienced surgeon, someone who's learning, somebody who's not committed, somebody who doesn't have his own team and his own anesthesiologist and his own program. When you give them this technology, like a Lamborghini, you don't just put a rookie driver in NASCAR drive a Lamborghini. You're going to basically flip the car and kill the driver and kill everybody else. So it's understandable that when you have prostate cancer, and I think the first line of treatment would be robotic surgery in the hands of experienced surgeons. Something called CyberKnife, which they call it robotic radiosurgery, has nothing to do with robotic surgery. It's a misnomer. This is a big marketing radiation groups that are constantly like putting ads in every bathroom and every subway. It's absolutely nonsense. There's not a lot of data that I see that's coming out. Be careful. The best treatment for prostate cancer is remove the cancer. Your PSA afterwards should always be 0, and use radiation as a backup plan in case the cancer comes back.